Scientists made a breakthrough by taking the pancreas cells from a healthy person and regenerating in lab and give to the diabetic patient can provide cure. This is a major landmark achieved by the scientist. In fact, it's approved by the FDA. The field of regenerative medicine has witnessed significant advancements in recent years, offering hope for the treatment of various medical conditions. One area that holds tremendous promise is the use of stem cells to replace or regenerate the diabetic pancreas. Diabetes, a chronic metabolic disorder affecting millions worldwide, results from the body's inability to produce or effectively use insulin. Stem cell therapy aims to address this issue by restoring or enhancing the pancreas's ability to produce insulin, thus revolutionizing diabetes management. In this article, we will explore the potential of stem cells in combating diabetes and the challenges that need to be overcome. The significance of stem cells in diabetes research. Diabetes mellitus, particularly type 1 diabetes, is characterized by the destruction of insulin-producing beta cells in the pancreas. Traditional treatment approaches involve insulin injections, but they fail to replicate the natural insulin regulation within the body. Stem cell research offers a promising alternative, aiming to replace or regenerate these damaged beta cells. By harnessing the regenerative potential of stem cells, researchers hope to develop novel therapies that can restore normal insulin production and effectively manage diabetes. Different types of stem cells and their applications. Stem cells are undifferentiated cells capable of self-renewal and differentiation into specialized cell types. Various types of stem cells hold potential in diabetes research, including embryonic stem cells, ESCs, induced pluripotent stem cells, iPSCs, and adult stem cells such as mesenchymal stem cells, MSCs. ESCs and iPSCs have the unique ability to differentiate into any cell type in the body, including insulin-producing beta cells. MSCs, on the other hand, can differentiate into pancreatic progenitor cells, which can then mature into beta cells. Direct differentiation of stem cells into insulin-producing cells. One approach in stem cell research involves directly differentiating stem cells into insulin-producing cells. Scientists have made significant progress in guiding the differentiation of ESCs and iPSCs towards beta cells through the manipulation of specific growth factors and signaling pathways. However, challenges remain in achieving a robust and efficient differentiation process that mimics the natural development of beta cells. Indirect differentiation of stem cells through pancreatic progenitor cells. Another strategy is to differentiate stem cells into pancreatic progenitor cells first, which can then mature into functional beta cells. This method holds promise as it mirrors the natural developmental process of the pancreas. Researchers have identified various transcription factors and signaling molecules that play crucial roles in pancreatic cell differentiation, and by manipulating these factors, they can guide the differentiation of stem cells into pancreatic progenitor cells. Overcoming immune rejection in stem cell therapy. One significant hurdle in stem cell therapy for diabetes is immune rejection. When transplanted stem cells come from a different individual, the recipient's immune system may recognize them as foreign and mount an immune response, leading to graft rejection. To overcome this, scientists are exploring different strategies such as immune modulation, encapsulation techniques, and genetic engineering to create stem cells with reduced immunogenicity or to protect transplanted cells from immune attack. Safety concerns and ethical considerations. As with any medical intervention, safety is a paramount concern in stem cell therapy. Researchers must ensure that the transplantation of stem cells does not lead to adverse effects such as tumor formation or uncontrolled cell growth. Rigorous preclinical studies and well-designed clinical trials are essential to evaluate the safety and efficacy of stem cell-based therapies. Ethical considerations surrounding the use of embryonic stem cells also need to be carefully addressed to ensure responsible and ethical research practices. Clinical trials and progress in stem cell-based diabetes treatments. Clinical trials investigating the potential of stem cell-based diabetes treatments have shown promising results. Several trials have reported improved glycemic control and reduced reliance on exogenous insulin following stem cell transplantation. However, larger-scale and long-term studies are needed to validate these findings and determine the optimal protocols for stem cell transplantation, patient selection, and long-term monitoring. Limitations and roadblocks to stem cell therapy. While stem cell therapy for diabetes holds immense potential, there are several limitations and roadblocks that need to be overcome. The scarcity of donor cells, the cost and complexity of large-scale stem cell production, the risk of immune rejection, and the challenges associated with differentiating stem cells into functional beta cells are among the key hurdles. Moreover, ensuring the long-term safety and efficacy of stem cell-based therapies requires extensive research and validation. Collaborative efforts and future perspectives. To overcome the existing hurdles in stem cell therapy for diabetes, collaborative efforts between scientists, clinicians, and regulatory authorities are crucial. The sharing of knowledge, data, and resources can accelerate progress in this field. Furthermore, advancements in gene editing technologies, tissue engineering, and personalized medicine hold promise for the future of stem cell-based diabetes treatments. Continued research, innovation, and collaboration are essential to realize the full potential of stem cells in replacing or regenerating the diabetic pancreas. Conclusion. The use of stem cells to replace or regenerate the diabetic pancreas represents a significant breakthrough in diabetes research. Stem cell therapy offers the potential to restore normal insulin production and provide a more effective treatment approach for diabetes patients. While challenges and limitations exist, the progress made in clinical trials and ongoing research instills hope for a future where stem cell-based therapies become a viable option for diabetes management. With collaborative efforts and continued scientific advancements, we can overcome the existing hurdles and unlock the full potential of stem cells in combating diabetes.